Hello, everyone. It's Wednesday, August the 26th. I got to start out and tell you that we've lost 11 more West Virginians. The total death toll now in West Virginia is 190. Our 180th death was a 65-year-old male in Logan County. 181st is a 72-year-old female in Logan County. 182nd is a 72-year-old, another female in Logan County. 183rd is an 86-year-old female in Taylor County. 184th death is a 73-year-old female in Wyoming County. 185th death is a 92-year-old female in Grant County. 186th death is a 64-year-old female in Kanawha County. 187th death is a 51-year-old female in Cabell County. 188th death is a 61-year-old female in Logan County. 189th death is an 87-year-old female in Ohio County. And our 190th death in West Virginia is a 72-year-old female from Mercer County. Now, I know without doubt the overwhelming majority of the deaths that we've occurred in West Virginia have come from our nursing home community. Without any question, they're coming from our elderly. And without any question in the world, they're the most vulnerable, and we know it, and we've said it over and over and over. All I know to do is urge all West Virginians to realize the impact of how dangerous this is with our elderly especially, but with all of us. For crying out loud, we've now lost 190 of our great West Virginians, and please, we've got to turn this tide. We've tested 409,000 plus tests in West Virginia. We gain more and more information every day. Every day we test. But we know now an awful lot about this disease. And we know that it affects the elderly first and foremost, but we know it can affect all. And we know also that we've got to find some way to live with it, don't we? And that's what we're trying to do until we get to the point in time when we do have the vaccine, and we can only hope and pray that that will come very, very, very soon. We don't have guarantees in any way as to what will happen. Maybe the vaccine will only protect, a few, and maybe it will clean up everything, and we feel certain that it will. But we don't know that there'll be a spin-off of this in another way. And so with all in us, we've got to continue on. But at the same time, we can do everything in our power to protect ourselves, to protect the elderly, to protect us. And we know that in West Virginia, we can win this war. We will win the war. But for crying out loud, it's just plain no good to be sitting here and talk about losing 11 West Virginians. So, but at the same time, the no good is nothing to compare with what's going on with these families. Please keep them in your thoughts and prayers. Please do. From the standpoint of our numbers, today we've got 145 new cases. That's way too many. Our positivity rate for today is 2.35. We're testing an awful lot, so therefore the amount of positive tests are growing without any question. The positivity rate of 2.35, people across this nation would love it if their state were in that situation, but we can do better. Our active cases are at 1,749. They were at 1,748 on Monday. They've gone up one. Our hospitalization, people that are hospitalized are at 143. They were at 141. You know, from the standpoint of so many things here, it doesn't look all that bad. But I just can't fathom sitting here telling you that it doesn't look all that bad when we're talking to 11 families that have lost a loved one. Our RT rate is at 0.87. We're tied for 5th best in the entire country. You know, today we have a new Orange County, and that is Kanawha County. You know, we have Monroe County also in the orange and Logan County in the red. You know, nobody ever said this was going to be easy, and nobody ever said that a pandemic would not be something that would be very, very difficult for all of us to deal with. And we're doing it, and you're doing a great job, but we got to get those counties out of orange, that's for sure. And we don't have our glide path to starting school is not very far away. So we've got to really, really button up in those, especially in the orange and the red counties. Now, if I could just show you something that I want to show you the graph of when we started wearing our mandatory mask and what it has done to the RT level. Have you got that, Jordan? All right, now let's just go back here. Let's talk just 1 second about this graph. If you'll look way back when, we had a 126 or 125 RT level, and at that point in time, we were the worst in the entire country. And then what has happened is, you know, we have dropped, and then all of a sudden, we were approaching the RT level of 1, and we had a mandatory face mask requirement, and look what's happened. We've dropped to where today we're tied for 5th best in the entire country. We see without any questions whatsoever that wearing our mask has worked. But we still have problems. We have problems with people going out of state. We have problems with them bringing this terrible killer right back into our nursing homes, to our hospitals, and it is a real live issue and a real live problem. We have got to be more careful with our elderly. We have got to be more concerned and more worried every day that each and every day, if we have another outbreak in another nursing home or whatever it may be, it just leads to more and more and more problems. You know, I want to tell you that I was incorrect about Logan County still being in the red. You'll see there that they have reduced, and now they're moving in the right direction, that they have moved to the orange, and that's really good. I want to make a special, recognition of a doctor today. Her name is Bridget Morrison. You know, she is the health officer in Greenbrier County and Monroe County health departments. And you talk about someone that has run to the fire with the Monroe County nursing home. You know, Dr. Morrison, we can never thank you enough. You and your team of nurses with the National Guard and all those that have been there at the Monroe County nursing home have saved lives. There's no question that we're going to lose lives there or have lost lives there, but you truly are a hero, and you have run to the fire, and you have surely saved lives. We cannot thank you enough. From our long-term care facilities today, there are 39 outbreaks in long-term care facilities. The largest outbreaks are in these 7. The Grant Rehab Care Center. In Kanawha County, you have 2. You have the Cedar Ridge Center and the Marmet Nursing Home. In Logan, you still have Trinity Health Care. In Mercer County, you still have the Princeton Health Care Center. In Monroe County, you have the Springfield Center. In Raleigh County, you have Pine Lodge Nursing Home. And in Taylor County, you have Rosewood Nursing Home. We've got to get things some way stabilized and back to normal with these patients and these residents and the staff and everything at these nursing homes. And there's actually 8 instead of 7, because in Kanawha County we have 2. But in addition to that, we've got to know that what happens with this situation is almost like I've said over and over with the night crawlers in a can. Right, as soon as you think you've got them all in the can, you turn around and look, and there's 3 more out there. And it could very well be that there's another 3 or whatever it may be throughout all of our state that break out. We continue to run to the fire and do everything within our power to stop this, but we need everybody working as diligently as they can. Please, I don't want to kick Myrtle Beach and throw them under the bus, but please think really, really hard about going to Myrtle Beach. And if you go there, please come back and quarantine yourself and get yourself tested and everything. Please look at where you go and what you do, and absolutely know that this is, we all want to live in this vacuum to where we believe this isn't going to happen to me. But it does, and when it does, then we're in real trouble. Our churches in West Virginia today have 4 active outbreaks reported in churches in 4 counties. Monroe County has a new one, Cabell, Wood, and Wyoming counties. And these outbreaks account for 29 of our total cases. All I do is go back and strongly urge you to follow the guidelines we have said over and over and over about our churches, and I would highly recommend to our elderly, if there's a way that you can get church services online or whatever, think really hard about doing that. We're still a long ways from out of the woods on all this stuff. From a corrections update, we have 130 negative results from the weekend testing at Mount Olive. We have 24 inmates that are positive at Mount Olive, and all the employees are being tested today. Corrections is now coordinating with both the local and the state health officials regarding expanding the testing to other housing units at the facility. At South Central Jail, all but 6 of the active inmate cases there have recovered. There are 3 active staff cases that are at South Central. At both facilities, inmates are medically isolated and quarantined as needed, and positive employees are self-quarantining at home. There was a big misunderstanding about our marching bands. And the information just did not flow to me. And you know what happened? As soon as I got the information, I said, for crying out loud, what are we doing? I mean, really and truly, can we not find a way for these kids to be able to perform? They work just as hard as the hardest working athletes on our football or basketball teams. These kids are just as devoted to their activities as our athletes that may be in a sports situation like basketball or football or whatever it may be. I know how hard they work, and I know how sincere they are, and sincere that they are dedicated to learning their trade. And their trade, naturally is music, and their compassion to compete, and their passion to be together with one another and everything. So I commend, once it was brought to my attention, I said, no way, we're not going to do this. If there's any way whatsoever, we're going to let those kids perform. So, I'm very, very happy to say that through our Department of Ed and the SSAC and our medical experts and everything, they came up with guidelines on how it could happen and how it could all work. And so from those kids' standpoint, we're going to enjoy hearing you at the football games and performing and continue to do your good work. As far as the cheerleaders and the dance teams and the majorettes and all that, if you're a member of the marching band and everything, absolutely, you're going to be able to perform. Now, in addition to that, the cheerleaders were exempt and they were going to be able to perform anyway. So I just wanted to clarify all that. I think we've got all that, in the right order right now. And as far as people going to see their children in the band or cheerleaders or majorettes or dance teams or whatever like that, the SSAC is putting that out from the standpoint we'll have to social distance and all that, but parents will be able to go and their family and watch these kids perform. From our small businesses, we're continuing to move right along on that. We continue to urge all of our small businesses. Our sole proprietors can now apply and everything, and we'll be sending out checks of up to $2,000 for them and 5,000 for our businesses that have from 1 to 35 employees. We need people to continue to apply. We've got 2,600 applications now. It continues to go up, but not nearly as fast as we want it to go up. So please, and if you're having trouble figuring out how to apply, call our office or go online and call this number and everything, and we'll help you through the process and get you qualified if we possibly can. From the standpoint of our cities and our counties, we've now sent out in excess of $92 million. There's 183 cities and counties that have applied. All this is going very well, and I'm tickled to death that it's going and it's all happening. The best comment I can give you is just one that I just got last Monday or a couple days ago, where a mayor was saying without the CARES money, we would have died. We didn't know what to do. The CARES money came, and all of a sudden now we're in great shape and things are moving and things are working very well. So that's what is supposed to happen, and that's what we're having happen. So that's good. From a standpoint of free testing today, we're in Lincoln County. This week we'll be in Mineral, Monroe, Mason, Webster, and Jackson counties. And all this is free testing. Just come out if you've got any kind of anxiety level or whatever like that. Come out and get tested, and especially our minorities, please come and get tested. From the standpoint of our summer feeding, we're doing the 696 sites. We've got a number of 211 to please call if you need assistance and everything. We don't want anybody to go hungry. For crying out loud, just please call us, and we'll make sure that we do not have that situation happen. Now, West Virginia, I've said it over and over. Idaho is at 94.4% right now. Washington is gaining on us, and they're at 88.1%. That's state of Washington. We're at 88.9% right now. Now, we're a good little ways behind Idaho, so we're going to have to kick it in gear and pick it up. But Washington State is at 88.1. We're at 88.9. So we got to stay ahead. Runner-up wouldn't be all that bad, but if we really kick it in gear, we can, we may run across the finish line in front of Idaho and everybody. So continue to work hard on getting counted West Virginia. I'm really proud of what you're doing. You're doing a great job there. Hurricane Laura is bearing down on the Gulf Coast, and all those people need to be in our thoughts and our prayers. But the track looks like it could turn and head all the way up into West Virginia and as a tropical storm. Now, I know a lot about hurricanes and everything because of our farming efforts along the coast, and I know how devastating they can be, and they can be unbelievable. And I also know about flooding. I've told you over and over, the 2016 flood, we found bodies. We didn't just look for them. We found bodies. 3 bodies on the Greenbrier golf courses. And we hunted a beautiful little girl for 6 weeks, and then she was found like miles downstream. We know what significant rainfall can do and can happen in West Virginia with our mountains. We know. And you also should know this year we have had an abundance of rainfall in the spring and summer, and so therefore our soils may not just be able to take up more and more and more rain. So we've got to be on guard. We've got to absolutely have our National Guard be ready and everything to help us in case this would become a tropical storm that would be coming over West Virginia and dumping all kinds of rainfall. So we've got to be ready for that. And so everybody kind of pay attention and watch the Weather Channel a little bit and stay on guard about that if you possibly can. Okay, from the standpoint of, I don't really see a need in looking at our graphs. You know, they haven't changed that much and everything, you know, but I really don't have anything else other than just to say, keep those 11 people, keep the 190 people that we've lost in your thoughts and prayers. I mean, they're precious West Virginians that we've lost, and they're great families, and I just hate it. I just hate it like crazy, and we're going to stay at this. West Virginia is still the beacons. West Virginia is still the miracle, you know, throughout our nation, but it still hurts, and I hate it bad for those people and everything. And so anyway, with that, I'll pass to our other experts.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and as the governor has said, that West Virginia continues to do a great job at controlling the COVID-19 pandemic spread. Certainly the graphs that we saw on the Monday brief and today, looking at the implementation of the executive order for the masking policy when indoor and when social distancing, physical distancing is not available, have made a substantial difference for both our RT values, our reproduction scores, the rate of spread between people with COVID-19 and people without, and also our percent positivity have both taken a very significant move in the correct direction. And really to your great work with that executive order, that it's made it possible for us to bring our RT value back down again. One new finding that is of some significance that's being talked about in the media is a new guidance by the Centers for Disease Control that perhaps not everybody who is asymptomatic and exposed to somebody who may have COVID-19 or is at a high risk of having COVID-19 needs to be tested. And this is a guidance that is a bit different than the guidance that we've seen before. And we're certainly waiting for a continuation of this guidance to be delivered. But at least my perspective on this new approach is related to the challenge that we have with how rapid we can get testing back. So we know from data that was published in the Annals of Internal Medicine that after an exposure from somebody with COVID-19, the earliest point in time that is really reasonable to test is 5 days. And at 5 days, about 50% of people that are infected with COVID-19 that are asymptomatic or pre-symptomatic will be positive if tested by PCR. By day 7 or day 8, that number goes up to about 70%. And I think that the CDC guidance is probably recognizing the fact that if we are going to ask people to quarantine for 14 days, if you've been a close contact of somebody with COVID-19, and we wait 5 to 7 days before we test you, unless the lab result can return in a really rapid way and within 48, 72 hours, which some of the labs are lagging behind that, then maybe it's just reasonable in selected cases to let people finish their quarantine, and as long as they remain asymptomatic for that 14-day period. But that guidance is still to be given. So I think it's important for people to recognize that that guidance has changed a bit. We are still very aggressively testing and will remain so, but we certainly do pay attention and also incorporate the guidance from the Centers for Disease Control within the approach that we take. The last thing is that we are working, and General Hoyer may address this further, but we are working to provide supplies of convalescent plasma, as that has been emergency use authorization approachable for people who have life-threatening problems with COVID-19 who may benefit from that. And with that, that's my comments for today. Thank you.
Great, thank you, Dr. Marsh. Next, we'll go to Bill Crouch, Secretary of the West Virginia DHHR.
Good afternoon, everyone. Let me first respond to a question that was asked on Monday by Mark Curtis. I erred in that response. The question really had to do with regarding the pandemic electronic benefits cards that are for the school lunches and whether or not those would be continued or extended. I was referring to the school clothing allowance program, which also uses EBT cards in my response, and I apologize for that. The PEBT cards were issued late spring as a result of schools being closed due to the COVID-19 pandemic. West Virginia will not be reissuing those cards, and the reason for that is county school systems across West Virginia have a variety of plans for students to attend school this fall, such as in person, electronically, or virtually. And because of that inconsistency, we're really unable to see how we do that going forward. As always, we're monitoring everything as we do go forward. Let me mention the school clothing allowance, since I discussed that a little bit Monday, to make sure I'm clear on that. We will begin accepting school clothing allowance applications on Tuesday, September the 1st. So that has not changed for eligible children enrolled in West Virginia schools. Each eligible child will receive a $200 benefit that may be used towards purchase of appropriate clothing or piece goods for families who sew clothing for their children. Public and private school students are eligible if they meet the income guidelines. So I hope that clears that up. Again, I apologize for any confusion on that. That's all I have.
All right, thank you, Secretary. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Continue to work a number of sanitization missions, working with Dr. Amjad and the public health folks related to refining our ability for rapid response to nursing homes as we continue to see outbreaks in nursing homes. As the governor pointed out, we are both monitoring and preparing for potential rainfall that may come from the remnants of the hurricane that moves up as it moves up into to our region, and we'll have pre-positioned material as well as forces, and we'll work with the Division of Emergency Management on those activities. As Dr. Marsh pointed out, there is an ongoing effort between the DHHR, West Virginia University, the American Red Cross, and the National Guard to work on maintaining some level of convalescent plasma so that it can go out in a timely manner and then be able to replenish that supply. Early on, the governor authorized us to purchase equipment for storage, as well as to be able to purchase some units of convalescent plasma, and we'll continue to do that going forward. Thank you.
Thank you, General. Dr. Ayn Amjad, our State Health Officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. Our first today is from Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron from WSAZ. My question is about back to school. I know last week Dr. Birx was here and praised West Virginia's back to school plan. I know last night Cabell County also revised its plan, which essentially has kids in school only a few days a week throughout the entire first semester, which really won't put them back in the physical building until 2021 full time, if it's possible. I wanted to know your thoughts on that based on the fact that the school return program was so heavily praised, and just about the impact on children and teachers and staff who now have to go ahead and switch their plans so quickly.
Well, Amanda, that, it gets back to what is the foundation of our entire plan. Our entire plan was all centered around local control and local input, because we felt like those superintendents and those school boards and everything, they would know what is best for their county. So as long as we have a real choice, that's involved here and everything, and people really, are inputting, the very best that they can input, we support that. We gladly support that and everything. And so we just think that the local control absolutely knows what is the very best. And we're going to try to be as supportive as we possibly can. So we'd welcome any kind of, knowledge or input from anyone. But, our State Department of Ed, I think is doing a great job. And absolutely, I'm very supportive of their choice.
All right, thank you, Amanda. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hi, everyone. Governor, first of all, I'd like to give you an opportunity to apologize for your outburst on Monday. Not for me, but for the people of West Virginia who found the behavior embarrassing. Second of all, Tom Frieden, former director of the CDC, called the changes in the guidelines Monday inexplicable and probably indefensible. Can we get some comment from the experts on Dr. Frieden's comments?
Gladly, Phil. I'll be tickled to death to get the comments from the experts. But and for anyone out there that would say that they're upset that their governor is standing up for what I know is wrong. I mean, Phil, let's just be real. Your questions normally center around the most trivial, negative things that they can center around. But that's okay. And I always answer the questions. But your behavior in making fun of people's deficiencies and putting it online and doing it through your social media and everything, these great workers here at the Capitol, if you expect me to apologize for you attacking our foster care and you making fun of hardworking, good people that work here at the Capitol, you're absolutely waiting for a day that is going to happen that is not going to happen, son. I mean, your behavior is inexcusable. That's all there is to it. It is inexcusable. And from the standpoint of me standing up for that, for West Virginians, for people out there that don't want a governor that's going to stand up for that, then I'm sorry to them. But absolutely, there's no way I'm going to apologize to you. Now, we can pass on to our experts and they can answer the rest of that question, please.
Maybe I'll take a shot at it if that's okay with you, Bill and Hein. Good. So Phil, that was really the question I was starting to address in my opening comments, that the guidance from the CDC is now that if you have an asymptomatic person who may have been exposed closely to somebody with COVID-19, that the new guidelines are that you are not always compelled to test. And while, for many of us, we would test aggressively in the situations where our contact tracing would tell us that we may have a close contact, somebody that's been within 6 feet or less for 15 minutes or more, because of the idea that maybe they connected with other people. So we want to finish that contact trace, which I think would be important. But I think the flip side, which I'm at least intuiting from the CDC, may be related to the idea that although 50% of spread is by, at least is thought to be by asymptomatic people, and maybe more is by asymptomatic plus pre-symptomatic people who don't have symptoms yet, that because of the turnaround time with some of the testing and the fact that we need to wait a certain amount of time after the exposure to have the test be likely come back positive. Again, 5 days, 50%, 7 or 8 days, about 70%, likely that if you had COVID, we could detect it by PCR, which is our most sensitive test. The CDC may have felt that that was not necessarily always having to be done, which may be at the root of the new guidance. Dr. Frieden, I think, is articulating a view of many public health people, which would say that the more testing we do, like we've done in West Virginia, the better. But like everything else, I don't know if there's only a certain only way that needs to be done. But I do think the CDC's new guidance is at the very best incomplete and needs to be finished with the rest of that thought, which is, to me, will likely be because people would have to be quarantined anyway, that maybe everybody would need to be tested. But that is a speculation by me, and I think we need to wait to get more guidance from CDC on this.
All right, thank you, Phil. Next, we'll go to Todd Boucher with WTAP.
Governor, I understand one of our Wood County delegates has sent you a letter. I don't know if you've received it yet, asking if you can find funding for some of the nonprofit veterans organizations in West Virginia. Many of them hold fundraisers throughout the year. Normally, this, of course, not being a very normal year, those events have been canceled. Do you believe that there might be money available in the CARES Act or somewhere else in the state budget to help fund those organizations?
Did I hear correctly that they're veterans organizations? Is that correct?
Yes, sir.
Well, I've not received the letter yet, but I can tell you from the standpoint of purely CARES, it may be difficult from the CARES side, but there may very well be a way to look at it through the grant side. And absolutely, I welcome the letter because anything we can do, to help the veterans, I'm all in. And so as soon as I get the letter and I'll find it, and I appreciate the question more than anything, because I don't want something like that to fall through the cracks and not get to me, because I'm going to push it, and I'm going to push it just as hard as I possibly can when I get it. Now, and let me follow up on Secretary Crouch. And I don't have a clue, if this is a go or not a go and everything, as far as these PEBT cards and everything. And I think the amount of the dollar number is staggering, and it's probably, from the standpoint of the issuance from the federal side, it's probably a no-go, because I think the amount of the dollar number may be as high as, in the tens and tens and tens of millions of dollars. But I just wanted to say just simply this, that we're going to continue to try in every way we possibly can to just help. That's all there is to it, just help. And from the standpoint, like you say, the veterans, and I hear you that it's very difficult to get out, do fundraising, do all the different things and everything. But Susan, I'll find the letter. We'll dig into it. We'll get you an answer, and but when it gets right down, when it boils right down to it, from the standpoint of those PEBT cards, they centered around feeding, and you can rest assured without any question, we're going to make sure our kids are fed. So long answer, but thank you.
All right, thank you, Todd. Next to Steve Adams with Ogden Newspapers.
Good afternoon. This is Steve Adams of Ogden Newspapers. And my editors wanted to ask the following. I know this is not COVID related, but they wanted to get your take on it, particularly the issues surrounding the Brooke County natural gas power plant. I know they're seeking a $5.6 million private loan, and I think they were looking for a state loan guarantee from the State Economic Development Authority. And I wanted to ask you if you've been briefed on this project, and if you knew where it stands, if support is going to be given from the state in regards to this natural gas power plant. Thank you.
No, Stephen, thank you. Let me just try to get my thoughts straight, because I have been briefed. I've been briefed multiple times. I think this project's been in the wings for years and years, probably 8 years or so. I think the project is and I want everybody to really pay attention to these numbers, because I'm the numbers guy. I think this project is a $1 billion project, $1 billion. Now, why in the world, if this project was valid and really a go, why in the world would the powers to be struggling and needing a state guarantee, a loan guarantee for $5 million? In other words, you've got people that are perpetuating this, and this is becoming the ultimate real estate with no money down. You know, I mean, it doesn't really make a lot of sense. Now, the other things that I've been told are just this, is I've been told that the way that was presented to us and came to me, you know, just weeks ago, very short weeks ago, you know, it came to me that 100% of this gas was coming from a pipeline that would be constructed into Pennsylvania, and 100% of the gas would be coming from Pennsylvania. Now, in addition to that, a great many of the workers that would be working on the plant, if it ever became a reality, would be coming from out of state. Now, from my standpoint, the media has run with this and really, you know, just perpetuated something that they felt like was a dead issue, and it's not dead. It's not dead at all. But you expect me as your governor and our staff to be able to have things run to ground and questions answered. Now, it's going to take some time. It's not going to happen day after tomorrow, the next day. It's going to take some time to get answers and assurances that we're surely not going to build a plant and everything for the people of Pennsylvania. You know, we have got to have benefits and jobs in West Virginia. You know, now, I'm also told that at the end of the construction period, this is going to, you know, secure, now get this, 20 jobs a year. That's it. You know, and so there is so many questions to be answered from the standpoint of, can these people really get funding? Or is the state going to be on the hook for a loan guarantee and just toast away $5 million that we need for a lot of other things? Can they get the funding? Are they going to use West Virginia workers to build it? Is the gas going to come from West Virginia? There's so many other things. Now, everyone needs to know this. I absolutely believe that the gas industry and the downstream benefits of gas are our future in many ways, are our future. And so I am as pro-gas as I can possibly be with a good, smart business head. Now let's just also think about this. Do we need additional generation in this state? If we close another plant for the betterment of this plant, are our ratepayers going to have to pay for years because the plant wasn't paid off or whatever it may be that goes through all the gyrations of AEP or wherever it may be? And so we need a lot of questions answered. Our people are trying to get answers and working through those and be just as pro-construction, pro-benefit, pro-gas as we can possibly be. But for crying out loud, you expect me to do my job. Now, from the standpoint of it being dead, of course it's not dead. There's no way it's dead, not from our standpoint. No way. We would welcome the construction. We would welcome the dollars spent. We would welcome the gas here and within, you know, the plant being built. We would welcome the gas being used here. There are so many things that we would welcome and welcome with open arms, but there's a bunch of questions that need to be answered here, and there's a bunch of stuff that doesn't make any sense. And the part that doesn't make any sense is you got a $1 billion transaction, and you got the owners or the powers to be not willing to put up $5 million. I mean, for crying out loud, you know, are you kidding me? You know, are we just throwing away money at nothing and there's no way they're going to be able to raise the money? And then if they do, are they going to buy? Are we going to really have a plant within our state that all we're going to do is bring gas in from out of state, our workers from out of state? Are we going to do that? Are we going to put other people out of jobs and everything? because the generation we don't need, I mean, there's questions that have to be answered, and that's what we're trying to get through right now. It's not dead. It's nowhere close to dead. We just got to answer questions. We got to do our job.
All right, thank you, Steve. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I have some questions about the process, Governor, especially concerning the band situation yesterday. And I know that you've said that you want counties to be leading the way in how their return to school and how their extracurricular activities are planned. But then we come out with a state map that's kind of guiding the way. And then the SSAC comes out with this ban on marching bands, blaming or crediting the DHHR with helping form it. And you talk to the DHHR and they said, well, we really didn't have much input. It was the SSAC. And then you came out yesterday and said, well, nobody talked to me about it. If they had, I'd ask them, what are they thinking? So you've said all along that you're running the show and the buck stops with you. And as the governor, I believe that. But is the SSAC aware that you're running the show and the buck stops with you? Because they act like that they're the ones setting the edicts and they're the ones setting the rules. And by your own admission, they had no input from you or the administration. So I'm a little confused. Are they out there on an island just doing what they want to do? Or are they actually taking input from medical experts? And as a follow-up to that, what advice are the medical experts giving to band parents and cheer parents and dance parents? Because what we were told by Dr. Marsh was we're going to give football parents the information and they can make their own decisions. Well, why didn't we treat band parents the same way? We give them the information about the risks involved and we let them decide if their children are going to participate. Thank you.
Well, Kenny, your question's got lots and lots and lots of different sub-questions, but let me just say this. From my standpoint, it makes no sense whatsoever to me that we have kids out there playing football that are right in the face of each other, and we can't spread out a band and let them perform. Doesn't make any sense to me whatsoever. Now, I also believe this wholeheartedly, that when you're singing or you're blowing into a trumpet or whatever, trombone or whatever it may be, you are perpetuating your voice, and that in itself is not what we want to do. But I think we can find safety and ways that it can be done. And so there are national guidelines out there that we need to be trying to follow as best we possibly can. We're trying to mold and adapt our ways to where things will work. But absolutely, from the standpoint of, is the SSAC in control or am I in control or whatever like that? All I would say is just this. When I found out, I don't want to be in a situation where it appears like that I'm throwing the SSAC under the bus, because they're doing a wonderful job. You got to know that there is a mountain of stuff that's going on and information that's happening all the time. The very, very best people are trying to do the right thing. Did the SSAC try to do the right thing? Of course they did. Of course they did. Did they maybe talk to some of the medical experts or whatever? I don't know. But from the standpoint of your governor and schools and everything, we need to absolutely try with all in us, and that's all I said is everybody full stop. For crying out loud, get the medical team, get the Department of Ed, get the SSAC, everybody full stop, because I personally do not see any reason whatsoever why our bands can't perform. And they've been doing this, they've been working on this and everything, and things and band guidelines have been in effect since the early summer. So with all that being said, I truly believe we stopped something that was probably moving in the wrong way, but innocently moving in the wrong way. Again, there ain't anybody better in the world in what they're doing other than Bernie Dolan and all the people that are trying with all in them to do the very, very best stuff they possibly can. But in this situation, we needed to move. We needed to move quickly. I asked all the medical experts, the Department of Ed, SSAC, to reconsider, try to figure some way that we could keep distancing and let our bands be able to perform. And they did that, and that's what we're going to do.
All right, thank you, Kenny. Next to Emily Allen with West Virginia Public Broadcasting.
Hi, Governor and panel. This is Emily Allen from West Virginia Public Broadcasting. My question is kind of similar to Phil's with the CDC guidelines and kind of the lags and shortages in testing. Like when I heard Dr. Marsh talking about that, I thought of our nursing homes and kind of their need for constant testing. I know antigen testing has come up. What is maybe, and this is probably for Dr. March or somebody with the DHHR, but what is the status of antigen testing in West Virginia right now? And as far as we know, what are some of the risks and benefits of that kind of helping out with the testing situation we're in West Virginia?
Dr. Marsh or Dr. Amjad, you guys have to answer this, please.
Maybe I'll start, Ein, and then you can add in if that's okay. So, Emily, thank you for the question. And certainly, as we know that the federal government has committed to try to outfit nursing homes with testing capability to do exactly what you said, which is maintain surveillance testing. What we know about antigen testing, and just to level set for the people who might be watching, antigen testing is testing proteins that are associated, really specific proteins that are associated just with COVID-19, which are the products of the genetic material that we test by the PCR test. So antigen testing is very rapid. We can do it in about 15 minutes or so. And during the flu season coming up, there are going to be capabilities to test perhaps for COVID and the flu all at the same time, which would be a massive advantage. So the advantage of antigen testing is it's much more rapid. It's done by a nasal swab as well, and then can be used in a point of care machine that can give you the information quickly. So that's the good news. And the other good news is if it's positive, it's very much like a PCR test. It's a very specific test. The challenge with the antigen test is it's not very sensitive, which means there'll be people with lower amounts of virus that may not get picked up by the antigen test, where it will get picked up by the PCR test. So what's been thought, and the way that we are considering antigen testing, and we were just talking about that today, in fact, as part of our testing group, is that in lower incidence areas, in the areas where we don't think that the spread is huge, like in an outbreak, we wouldn't use it. But when we're looking at surveillance, then an antigen test is actually quite good, because we want to pick up the people that have a good amount of virus that can spread to other people. But because the incidence is low, we're not looking to try to be very, to try to get the detection down to a really low level of detection. In outbreaks, though, where we have a positive test, then we would use genetic tests, the PCR test, the regular COVID test, because it has a much better ability to pick up everybody who might have infection with the disease. So we are working to use the antigen test as part of our portfolio of testing, probably better used for surveillance testing, or if used for infection, it is best used in the very, very first days and even first hours of people being symptomatic. But maybe not so good to screen a whole population like in a nursing home if we have an outbreak. So I hope that makes sense, but we do believe antigen testing has an important role in the future of our testing, particularly because of its rapid turnaround and ability to allow us to do surveillance in a more consistent way.
All right, thank you, Emily. Next to Haley Kosick with Nexstar Media.
Good afternoon, everyone. My question is in regards to, with the start of school around the corner and with so many children in West Virginia under the care of their grandparents, one viewer in particular just brought it to my attention, the concern that with the elderly being the most vulnerable population and with children under the care of their grandparents, there is that concern that if there were a potential outbreak in any school across the Mountain State. Can you comment on that, or anything to maybe calm these worries? I know it, it is certainly a worry out there for many West Virginians.
Well, it's a concern for all of us. At the end of the day, I've said this many times, but if we have a situation to where, we have an outbreak, a hot spot, or whatever it may be, we do have all the resources with all of the medical team and all the National Guard and all those people to be able to run to the fire again. We have discussed this beyond belief with all of our medical team. We've been round and round and round and round. It won't be perfect. There's no way it'll be perfect. But we believe that the exposure is very minuscule compared to the detriment that could very well happen to all these children and all their parents and everybody, that needs to go to work and doesn't have daycare and all the different situations that you may want to compound the situation with. But we know that there is a real live detriment out there. And we know that there's some level of risk out there if the kids stay home and they go to each other's houses, or they go to Walmart or the Dairy Queen or whatever it may be, versus if they're in a school that we're trying with all in us to keep as safe as we possibly can. We believe that it is best and it is okay to go back to school. But we also know that it's not going to be perfect. And we are going to have instances that we're going to have to address. And we're going to have to run to the fire. We're going to have to be on our toes and everything until we get to that point in time where we've got that drug or vaccine to stop it.
All right, thank you, Haley. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. The color-coded map that was introduced a couple of weeks ago now applies to multiple things, to schools, and related to that, to sports, also now to nursing homes. As colleges open up, should the community spread as shown by the color-coded map apply to colleges also? Thank you.
Oh gosh, Brad, you're way beyond my pay grade now. I really don't know how to answer that without a lot of input from our education, our higher ed people, and all that kind of stuff. That one's out of my pay grade. I don't know if anyone else on the panel may want to try to answer it, but I don't know how to answer that. I'll surely research it and try to figure out something if to get back to you and give you the input of the people from our higher ed people and our Department of Ed people, but I can't answer that one.
All right, thank you, Brad. Next, we'll go to Bailey Pace with WVVA.
Hi, my question is for the governor. If it's safe enough to send children back into classrooms, why is he still holding this press briefing virtually?
Well, to just be as straight up as I know how to be and everything, I am trying to go to certain places and do certain things and educate everybody as best I possibly can. I don't really, we're taking every question that comes in. We're trying to answer every question as best we possibly can. We're trying to take every precaution that we can possibly take and everything. To run everybody down here and put everybody in a small room and everything, I don't know that there, what could possibly be beneficial about that and everything. And I surely don't know how that could be beneficial from the standpoint of our children and at school. And so we're going to continue to do this just like this. We've got 8 or 10 people in here. We take every question that comes, whether it be COVID or not COVID. We want them to all be COVID related, but I think we're doing the right thing, and I think we're doing it as safely and as best we possibly can.
All right, next we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. Question about building ventilation. Is it a concern? Have you checked out the schools for ventilation, even the nursing homes? Perhaps that's a combination question for the medical experts and for you, Governor.
This is Paul, is that correct? Paul, let me just say this, that we're going to continue to all have questions about, I mean, no matter, Paul, if I had 100 years and 1,000 people to try to absolutely be sure that every single thing was just perfect, we're going to have questions and we're going to have concerns. From the standpoint of ventilation and everything, how fast could we get ventilation? How much does it cost? You know, what are the benefits? There's so many different things that come into play. We will have questions and we will have concerns. And we will have to deal with this as best we possibly can because it's right here with us. Absolutely, there's going to be those concerns and those questions. And we've got, the choices are so simple. The choices are just this. Everybody go to their homes. Everybody stay in their homes. Nobody come out of their homes. Let's don't have school. Let's shut down the entire economy. It is just as simple. We can do that. But even if we do that, we're still going to lose people. You know, and really if we do that, the repercussions are unbelievable. Just envision, if you would. You know, we went through a terrible depression in this country a long time ago. And what happened in that depression? You ended up with neighbor against neighbor. You ended up with crime. You ended up with everything off the chart. You ended up with starvation. You ended up with so many things that were really bad. Sure, there's concerns. We've got to figure a way to live with it as best that we possibly can. Now, I'll welcome anybody else on the panel to talk about ventilation and everything because you may know it 1,000 times better than us. And Dr. Hoyer may very well know it. You know, our Board of Education, our people, our superintendents, they're inspecting buildings like crazy and doing everything that they possibly can. You know, I don't know what else can be done right at this time, but I'll pass to our panel.
So maybe I'll start, Governor, and I know Dr. Amjad, we've been working with her and Dr. Marsh and others on this. So early on, the governor tasked us to establish some technical support for a variety of facilities. We have some technical experts that work with a group of folks at both DHHR, some folks that have some significant hazardous materials and ventilation experience. And we have made a number of recommendations to nursing home facilities to address ventilation issues as we've had outbreaks, to also help with ventilation flow related to isolation activities in facilities. We have had some inquiries from different county school systems about providing some insight on helping improve ventilation in buildings. So it is an ongoing effort. There's a lot of research that continues to be done. It's a combination of technical experts and public health experts. We have the assistance from WVU's Inhalation and Toxicology Lab that provides work and support, and they work with the National Institute of Health. So a number of activities going on, and Dr. Amjad could talk some more about some of the things we do specifically with facilities.
Thank you. Yes, the National Guard has been very active with the nursing home outbreaks. They go into the nursing homes, they work with the local health departments and the administrators for these nursing homes to check their HVAC systems and to make sure that is not contributing to the infectious spread of COVID-19. So they've been very active with that. So speaking of the school systems, that is something that they can assist with. Also the maintenance departments of the nursing homes, but that is something that we check with. That's why masks are important and social distancing in these areas. We were on a call this morning with the superintendents of the counties with Clayton Birch, and we had some of these questions about social distancing and masks, and that is also why these things are important. But HVAC systems, airflow systems in buildings are something that are looked at very heavily, especially in our nursing homes, and the National Guard has been helping us very actively into these systems. Thank you.
All right, thank you. Governor, I'll turn it back to you.
Okay, I know we had a couple more questions and everything. I apologize for not being able to get to all those questions. You know, our Secretary of State has an event that they're going to be doing at 2 o'clock, and it's an incredible celebratory event, you know, for an anniversary of 100 years that now we're celebrating, you know, that our women were able to vote, and their contribution is phenomenal in every way. And so, we don't want to run right up against that and everything. And so all I'd say in parting is this: way to go, Logan. Absolutely. You got yourself out of red and everything. You keep working and right. I know we've had a tragic situation where we've lost lots and lots and lots of loved ones down there. We're going to keep you in our thoughts and prayers, and keep doing good work and everything. And let's just get Kanawha County and Mingo. Is it Mingo and Logan? Is that the two counties? I think no, Monroe and Logan, you know, that are still in the orange, and let's get them all out of the orange and everything, and to keep doing their good work. But thank you so much.